My name is Ashley Green. I'm from Springfield, Illinois, and I've had psoriasis for 21 years. The thing I'm most passionate about is traveling. I love traveling all over the world and living with various families and communities and getting to know the different people and cultures there are, and I love reading and hiking. What were the signs and symptoms that have led me on my current treatment path? It was about 3 years ago, not quite 3 years ago. I was kind of at a very low point in my life. I was working on my PhD, finishing my dissertation, and I had been on the exact same treatment plan for the most part since I was 15 years old, and those had been fairly ineffective that entire time. And I was sitting there in the dark room, and across the TV there came some type of endorsement for a more aggressive approach to treating psoriasis, and a biologic where they were going to actually approach the disease from the inside instead of the outside. And a light kind of went off where I started researching and looking more in depth into the various different treatments that were available to me. And I would say that that was definitely a turning point when I realized that there had to have been some kind of advancement, some type of improvement in the treatment of psoriasis since 1995, and I pursued that route then. My greatest source of support with the disease kind of comes in two different folds. One is the past and one is the present. In the past, I've had a wonderful network of friends and family, all of whom have been very accepting of me with the disease. But presently, I have met a wonderful physician, dermatologist, who educates me about the disease and lets me know that I don't have to live this way, and in fact I can improve my quality of life. And I've also been involved in kind of these outreach programs where I've met for the first time ever other psoriasis sufferers, and this has been such an amazing source of support because we can share the various different treatments, what it was like to live with the disease, our different experiences, and this has been one of the most meaningful parts of having psoriasis in the later part of my life. What advice would I share to someone who has just been diagnosed with psoriasis? Most importantly is to be empowered. Be sure that you research the disease, you try to understand thoroughly the different treatment options that are available to you. Be extremely communicative with your dermatologist. Tell him or her how it's affecting you, how it's interfering with your life, how it makes you feel, how uncomfortable you are physically. Also, I guess it's important to mention that you need to keep in mind that the disease has this really unique capacity to isolate the sufferer. In addition, it kind of makes you feel like you don't have any control. You don't have any control over what's happening to your body. You don't have any control of how severe the outbreaks are. And in this way, it also makes you shrink a little bit, and it makes you become quieter, and it makes you feel like you don't have a whole lot of power. So your alternative then would of course be sure to empower yourself. Be sure that you learn as much as you possibly can and have some kind of grasp on these different treatment options that are available to you. I hope my story inspires in others an understanding that life can be better, and understanding that your quality of life can improve. You do not have to live like you have been living in the past. There are such progressive treatments, there are such advancements in the treatment of psoriasis and the understanding of what the disease is and how it can manifest itself. So your quality of life can be significantly improved, I promise.